What's happening inside our gut often goes unnoticed. But the reality is that our gut health ensures our overall well-being. Let's understand more from Dr. Hardik Ahuja, MBBS, MD, Gastroenterologist. How does our gut impact our health?
See, gut is a very important part of our health, and it impacts overall body in many senses. Like it impacts our brain health, it impacts our heart health, it impacts our diseases which we have or we may not have, which we might develop in future, and it also impacts our mood and our anxiety and our stress levels. So it has a major role in our life.
You also mentioned about gut microbes and microbiome.
Yes.
Now, how does our gut microbiome impact our well-being and our health?
Gut microbiome is a very crucial thing which people generally don't know about. So it impacts our immune system a lot, and it has a role in many diseases also, including like some autoimmune disease and some gut disease like IBD, IBS, etc. And nowadays scientists are discovering more correlations between the gut microbiome and other diseases as well. So gut microbiome has a very important role in that they regulate the immune system of the gut. They also have many secretory and absorptive and some metabolical factors like short chain fatty acids, methane production, 5-hydroxytryptamine production, that all impacts our gut health also at the same time. So having good bacteria in gut is very important. And when we eat drugs like antibiotics and other things, the good bacteria gets depleted and we faces much problems. There are many gut issues with the people who keep taking antibiotics for one or the other purposes. So we need to see that we need to keep replenish our gut bacteria, good bacteria, I'd say.
Now, what are some of these health concerns or critical illnesses that can rise due to an unhealthy gut?
There are many diseases which are possible. Like if you're talking about only gut diseases, then I'll say there are IBS. Nowadays, people who suffer from stress or anxiety, they are all complaining of difficult bowel movements and pain abdomen and all these things. These are IBS patients. And now coming on to inflammatory bowel disease, that is inflammation in the bowel due to poor gut bacteria, or you can say there are many other causes also, but we are now talking about the gut microbiome. They all influence almost all the gut related factors. Like some people have irregular bowel movements or frequent bowel movements, like they have diarrhea. Many people pass stools 4 to 5 times a day, which are loose. So they usually in these patients, people have found in studies that the number of good bacteria are less and the number of bad bacteria are more. So this obviously influences the intestinal microenvironment.
How can we determine or diagnose whether a person has good microbiomes and or bad microbiomes?
See, if you're talking about diagnosis, it's only a clinical diagnosis. Usually, this is a research thing. So what we have found in our study is that people who suffer from these disorders, like I'm talking about IBS, IBD, celiac disease, or whatever you're talking about gut health, even constipation, and people who have frequent diarrhea, they are found to have poor intestinal microbiome, poor quality of intestinal microbiome. So there are two types of bacteria. There are good bacteria and there are the bad bacteria. So the good bacteria are like bifidobacterium and lactobacillus, and the bad bacteria are like Escherichia or it's like Campylobacter, etc. So there is always a balance between these bacteria. So when this balance gets altered and the bad bacteria predominates, then there are gut problems.
So as a doctor, how do you diagnose a patient who comes to you and you tell them that yes, your gut is not functioning properly?
Basically, we diagnose the patients on the basis of their symptoms.
What are some of their symptoms?
Symptoms are like pain abdomen, gaseous abdomen, abdominal bloating, heaviness in abdomen after eating food, difficulty in passing stools, and poor bowel movements, and feeling constipated all the time, etc. etc.
Now, constipation. If I tell you 5 major causes of constipation, what are they?
First is lifestyle. Second is poor fiber intake. Third is decreased physical activity. Fourth is decreased fluid intake. And if you talk about 5, then we can say stress or anxiety.